Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in the profession. Today we'll be seeing about hospitalized child. So during hospitalization, how the child reacts. So we'll be seeing about for each and every age group the reaction towards the hospitalization. So when we consider about the childhood period, the childrens, they consider the hospital as a haunted house, and the doctors and the healthcare professionals like nurses like devils and demons. Why? Because they are wearing the stethoscope, they are wearing the white coats, and also they'll be doing some of the painful procedures on children. So children consider it is something like a haunted house, the place where they are being treated, and they will have some painful procedures there. So in simple term, the children think like that only. But when the child grows and come to know for their benefit of their well-being, like physiological improvement and psychological improvement, the child will adopt to the hospital environment. So here we'll be seeing about how you have to prepare as a nurses, how we are going to prepare the children from the neonate to adolescent, and also the preparation of the caregivers during the hospitalization. Because when we consider about some of the age groups like preschooler, schooler and all, they consider the hospitalization is something which is being done for their punishment, or they have committed something wrong, and for that purpose they are being admitted in the hospital. Like that they consider the hospitalization. But when they become matured and get into the adolescent period, then they will come to know that okay, the hospitalization is something which is going to benefit our health in the way of physiological and psychological. So we will see one by one in detail and their reaction towards the hospitalization. So definition: the confinement of a child or an infant in a hospital for a diagnostic testing or therapeutic treatment, regardless of age or degree of illness or injury. Hospitalization constitutes a major crisis in the life of a child. So the child thinks that the hospitalization is one of the major crises in their life. So it is going to like ruin their life. They think in that way. But in simple term, hospitalization is something, a confinement of child in the hospital for any diagnostic procedures or treatment purposes or the benefit of their health. So we are going to act on their illness and wellness. So it is going to act in that way. So next we'll be seeing about meaning of hospitalization to a child. So according to various age group, the infant, during the infancy period, the hospitalization causes a change in familiar routine and surroundings, response with global reaction, separation from love object, and in toddler, fear of separation, desertion, separation, anxiety highest in this age group, relates illness to a concrete condition, circumstances or behavior. So during the infancy period, they will be having some of the very attached toys or any pillows like that. They'll be having, they love carrying that things. But once they get into hospitalization, they will miss those all favorite items or toys. So that is going to change the reaction towards the hospitalization. And also toddler, they think that if I am getting hospitalized, I will be separated from my mother, or I will be separated from my father, my siblings, and they have separation anxiety in the highest point. They think if I am getting hospitalized, my parents will go away, they will not come back again, they are leaving me in this hospital for the punishment of what I have did. So again the child will be telling like, mama, I will not do anything wrong, I will not do anything wrong, like that they will be telling. So they think the hospitalization is something a punishment. So in preschooler, they fear of bodily harm and mutilation, castration, intrusive procedures. So here also they have a separation anxiety, and here they think that the causation of this hospitalization is due to the wrongdoing or a punishment. So toddler, so same as that of toddler, they also think in the same way, preschooler. So in school age, they think that their physical, the illness, about their illness, they will think in very complicated manner. So if I am having fever means I will get pimples, like that they think in that way. So my body will get reduced, I will not have my chubby cheeks, like that. Next is in adolescent, they will become anxious regarding the loss of independence. So they will lose their privacy once they have been getting hospitalized. They lose their privacy. They mainly concerned about the identity and privacy, and also that able to explain the illness. Like in the adolescent period, they are the miniature of adulthood, so they will be able to explain in detail about what has caused, what difference is happening in their health, what physiological changes and psychological changes is happening in the adolescent. Like that, adolescent will come to know for what purpose they are being hospitalized, but their main concern is, one is they will lose their independency, and also they are more concerned about their privacy because they are being hospitalized in a group of, with a group of peoples. So mainly they concerned about their privacy, and also they perceive that that is a malfunctioning has taken place due to the illness. Like that, they will think in very deeply, they will think. So some of the organ system is getting affected, so my body is something affected, so they think in very drawback manner. So next we'll be seeing about preparation for the hospitalization, how we are going to prepare. So preparing for admission. So once the baby is being admitted, what and all we can do is, one is we have to assign the room based on the developmental age. Like if they are infancy period, means they will have some separate intensive care unit or separate ward, pediatric wards, like that. So if they are adolescent, means separate ward will be there. Next, prepare the roommates. Like you can say, yes, one more person is going to accompany in your nearby bed, like that you can make. Next is prepare room for child and family. So once the child is getting admitted, the family members also will be there along with them. So that is a rooming in policy. Next is admission. So you have to introduce the primary nurse. So if I'm going to do the admission of the child, means I will greet the child like, hello, welcome to the hospital. You are being admitted in the bed number 10, 11, like that you can orient them. So orient the child and family regarding the nurse's station, where is the toilet is available, where is the canteen is available, where is the play therapy area is available, and where we can go for lift, where steps, staircases are available. Like that you can orient the family and child. Next, perform the nursing admission history. So once we as a nurses going to collect the history regarding what all happened, what all the laboratory investigation has taken place, what is the past health history, what is the personal history, what is the immunization history, everything will be collected. Next is we'll go for the basic vital signs checking from temperature. So TPR, temperature, pulse, respiration and blood pressure. Next, assistant physical examination. So we will also perform the physical examinations along with the physicians. So if the physician is doing any physical examination, means we'll be assisting with them, and will be come to know like if they're having any pain, or and also we will also do the assessment and do the Nanda diagnosis. So prioritize their signs and symptoms, and we'll do the Nanda diagnosis. Next is preparing for discharge. So even once the baby is getting admitted into the hospital, we have to prepare in some of the steps to be carried out, and in the same way discharge procedure should also take place. Like you have to give the education to the family members regarding what is the prognosis of the disease and when the follow-up has to take place, like that. If a baby is having any cannulas or tubings, like they'll be having the venflon in their hand, means you have to remove everything, and you have to give the health education regarding the dietary management, follow-up care, like that everything has to be carried out smoothly. Next is preparing the child according to the age group. So once we are going to prepare the child from infancy to toddler to everything. So during the infancy period, once it is going to be the planned admission, so you can just explain their caregivers regarding, you can bring your own toys. Like if a baby is having any favorite toys or pillows, anything, means they can bring along with them during their hospitalization, so that the child will not feel insecure, and also the baby will feel like okay, my favorite toy is with me, so I'll be in the hospital, like that. So next is preparing the toddler. So mainly in toddler they will feel mainly three fear have, that is fear of unknown, fear of abandonment, and separation and fear of mutilation. That is separation anxiety will be in the highest peak, and also fear of abandonment. That means they get abandoned in the hospital. So no one is there is in the hospital. I don't know anyone. So my parents will leave me here itself with unknown persons, like that. And also they feel abandonment means they are being in the place where no one is there. like that. Next is here also you can encourage the child to bring the favorite toy that will help them during the hospitalization. And also even in the hospitalization you can encourage the toddlers to do the play therapy. So we in the hospitals we are inculcating the play therapy in the treatment process, no? So in the same way you can ask or encourage the child to go and play in the play therapy area that is being allocated in the hospitals. So this is the preparation of the child according to the age group from the infancy period, how and all you have to prepare, because during the infancy period much explanation is not needed because they don't understand very easily, that too the early infants. But late infants, they will have some reaction towards the hospitalization, so we have to prepare according to the early infancy and later infancy. Main thing is, like, once it is being planned admission, you can bring all the toys whatever the child likes for both infancy period and the toddler period. So this is about the preparation of child according to the age group, that is preparation of the infant for that admission procedure and preparation of the toddler for the admission procedure. So next we'll be seeing about preparing the preschooler. So first we have to explain the healthcare experiences before the hospitalization. Next we have to use very simple words to the preschooler regarding their need for hospitalization. What is the cause of hospitalization? Like we can explain, like, you are having a increased body temperature, so we have to collect your blood samples and we have to check for what type of fever it is. Like that you can explain them in very simple words and in an understandable language. And also you can encourage the child to talk about her or his feelings. So during the hospitalization they will be feeling something very boredom or very depressed, or they feel frustrated, or they have some anxiety. So in order to relieve or elevate these all symptoms, you have to encourage the child to ventilate their feelings regarding the hospitalization. So this is about the preparation of child, that is especially the preschooler, for the hospitalization. So once the preschooler will understand whatever we are telling, so when we compare with the infancy or toddler, the preschooler will understand more often regarding whatever the instructions we are giving. And also we have to provide the privacy whenever and wherever required, and each and every procedure has to be explained to them in order to prevent the anxiety on them. Next is preparing the school age. So we have to prepare as early as possible. Next, talk to the child and ventilate their fears, and if they have any questions, you have to encourage them, ask the questions very openly. Next is explain the child exactly why they are being hospitalized. This is causation of hospitalization. Next we have to provide the orientation, like where is the nurse's station is there, where is the alarm is available. So about their roommates you can orient them. So where is the canteen available, where is the lift available, like that you can orient. So next is preparing the adolescent. So since they are being the miniature of the adulthood, you can include them in all the discussions. So if a doctor's rounds is there or the nurse's rounds is there, you can also ask, like, how you are feeling, like that they will able to explain you exactly what they are feeling in that particular day. So you can just include them in all the discussions. So encourage the adolescent to ask the frequent questions. If they have any doubts, means they can ask and clear it. Next is preparing the child of a different cultural background. So you have to make sure that, and you have to assure them that proper care will be provided to the child without any differentiation. So since in our, as per the nursing ethics, we don't do any discrimination, and we consider each and every patient equally, and we do not discriminate in the grounds of caste, creed and color, everything. You have to explain them. And the same way, preparing the disabled and chronically ill child means, for example, if a child is being hospitalized for a prolonged period of time, you have to prevent restricting the visiting hours. So whenever and wherever required, like, you can ask them to call their friends or teachers to ventilate their feelings and all. You can just make the students to ventilate among their peer groups. That is the preparation for the disabled or chronically ill child. And in the same way, the visiting hours should not be very restricted. It should be very flexible. Next is preparation of family caregiver. So far we have seen about how we are going to prepare the each and every age group children from infancy to adolescence. So now we will be seeing about the family caregiver. So planning for hospitalizations begins as soon as the parents know that hospitalization will be necessary. So it is very clear that as a pediatric nurses, we are in a position not only to prepare the children but also the family caregiver. So you have to first explain regarding what is the purpose of hospitalization, what is the main cause of hospitalization, and how we are going to prepare the children, and you have to ask the parents to ventilate their feelings for the children's hospitalization. And the same way, if they have any questions, because they have the right to information, so if they have any doubt regarding the prognosis of disease or treatment modalities, or what are the therapeutic procedures we are going to perform on children, or what are the diagnostic procedures we are going to perform on children, each and everything should be explained in detail, and they should ask each and every questions from the healthcare personnel. Next is effect of hospitalizations on family and children. So since in the beginning I have said, like hospitalization is being considered as a haunted house. So we nurses and healthcare professionals are being considered as devils and demons, like that in their own world. In children's world, we are being considered like that because we do injections, we give medication. So we are the children's considered in that way. So each and every age group, they consider the hospitalization in different ways. So they have a different effect. So mainly parents think that they feel very guilt, they feel very depressed, anger and frustrated, and siblings, they think that they feel very lonely and they feel very resented, like that. Next is child reaction to hospitalizations and prolonged illness. So illness threatens both physically and also psychological development of children. So hospitalizations and prolonged illness related to growth and development, it causes the adverse reaction in child based on the stages of development. So once they are being admitted in the hospitalization, their normal routine get affected. So absolutely it is correct, because even for the adult, when they are being admitted, their normal routine gets affected. In the same way, when a child is being admitted, their normal routines like basic needs, and also the school, when if it is a school going children, means that is being affected, like that. Each and every age group have different effect. So first is reaction of neonate. So when we consider about the hospitalization for the neonate, it is not going to make a much difference on the neonate, but since they have a lacking of the bond from their caregiver, that is from the mother. So once the neonate is going to get the feed from the caregiver, so that will be lacking, and that emotional bond will be lacking by the neonate. So neonate, that period is from the 0th day of the baby is born to 28 days. So the reaction will not be very evident on the children, on the neonate, but whereas the emotional bonding between the parents, that is the mother and the baby, gets affected, and also the baby will not have a impaired bonding and trusting relationship will be there. So that will get affected, and also the inability of the parents to love. The mother will long for the love of the neonate. So that is the main reaction of neonate. So mainly they will be having the they have a poor sleep, they will not take the feed properly. So that is the main reaction of neonate. So next we'll see about the infancy period. So infancy period, so in the early infancy also, it is same as that of reaction of neonate. So when we consider about the later infancy, like from 10 months, 11 months and 12 months, so baby will exhibit separation anxiety. They think that the parents are going to leave the child in the hospital and they are going away. They feel very unknown, they are between the unknown persons, like that they feel, and they have emotional withdrawal and depression. And when the infants get hospitalized, their growth and development get interfered, and older infants have a limited tolerance. So due to separation anxiety, they have a nil tolerance. So whatever the procedures we do know, they will deny, they will just cry and cry. Next is reaction to toddler. So again in toddler, they have a highest peak of separation anxiety. They show a regression in an attempt to control stress. Next is reaction of preschooler. So mainly they have various defense mechanisms like regression, projection, displacement, identification, aggression, denial and fantasy. So fantasy in the sense, they think that during the hospitalization, they think that they are being in something new kingdom. So they are in the fairy world. So they play. So for these purposes only, we inculcate the play therapy in the children's play treatment modalities. And in the same way, the separation anxiety is going to be the highest point in the later infancy period, toddler period and also the preschooler period. So separation anxiety means where they are being separated from their caregiver. So for next when they are being admitted, they are not going to get the same love and affection, nutrition, everything from their caregiver. They think in that way. Next is reaction of school age children. So children are concerned with fear, worry and modesty and privacy. So defense mechanisms like regression, negativism. So negativism in the sense they will say that I am being hospitalized, something is going to happen to me, like that they will tell. So fear or denial. So whatever the procedures, if we are going and asking for the permission or consent means, they will say no, 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 like that. Next is reaction of adolescents. So they mainly concerned about the privacy. So since they are being admitted in a ward means, they will be just mingling with all the peoples, right? So they feel that they have a lack of privacy in their hospitalization. Next is anxiety related to loss of control, insecurity in strange environment. So since they are being in the environment that is away from their own home, so they consider it as a very strange place. So they will be uncooperative. So we will see in detail about what is a separation anxiety. So separation anxiety are the major stress from middle infancy through the preschool years, that is between 16 to 30 months. So phases of separation anxieties, first one is protest, despair and detachment. So protest means they will cry, they will not allow anything to do, they will just cry, they will ventilate only crying, they will not laugh at all. So next is despair and next is detachment. So again despair is something like you will also deny, you will not allow that nurses or any healthcare persons to just touch you or do any procedures. Next is loss of control. So in infancy they will lose the control when they develop that mistrust and decrease the sense of control. To toddler they will develop a temper tantrum, so they will cry and they will not allow any procedures to be performed on them. Next is preschooler, they have an altered routine and physical restriction, they will lose their control. Next is in school age children, they feel boredom. So once they feel bored, they lose their control and lead to frustration and depression. Next is bodily injury in pain. So when they do bodily injuries, like infant, they will express their pain by screaming, breathing, jerking and crying very loudly, and refuse to lie still or try to escape with motor activity. So they will not lie down at all. Next is in toddler, similar to infancy, they will show the pain. Then they express by grimacing, like just seeing on the object very opening their eyes and seeing. Next, clenching their teeth. Next, just holding their fist and just like that they will be making the sounds. Next is preschooler, express same as that of toddler, and physical and verbal aggressions are more specific, and they will also verbally abuse the nurses. Like if at all I am the nurse, I am going to give any injection or any IV administration, they will just make a verbal abuse on the caregivers. Next is school age also, they will exhibit the same as that of the preschooler. So that's all about the hospitalized child. So what is the effect of hospitalization in the children, and how we are going to prepare the children during the admission procedures and the discharge procedures. And also we have seen about different reaction of the hospitalizations on the children, that is from the neonate to the infancy, from the toddler to the preschooler and the school age and adolescent. So each and every age group exhibit something different reaction towards the hospitalization. And sometimes if we prepare the children before the hospitalization, we can prevent these all withdrawal symptoms. And mainly these children will have a separation anxiety on the top of the peak, that is mainly during the toddler period, preschooler period. So they also think that they are being abandoned, and they feel they are being mutilated in that area, and their bodily figure is going to get changed, like that they think in very depressed manner, they get frustrated during the hospitalization. So these all can be prevented only when we prepare them psychologically and physically before the admission. So if it is going to be a planned admission, you can just prepare the parents as well as the children of different age groups during the hospitalization. Like you can bring your own toys, there's a play therapy unit is there, so you can orient the child. So once we are orienting the child, the baby will feel secure and they will not have any strange environment fear, and they will not even have a separation anxiety. And as soon as possible, we have to do the rooming in policy. So when a baby is getting admitted, you have to admit their caregivers also, so that you can prevent a major reaction towards the hospitalization. If you have any doubt, kindly drop down in the comment box, and kindly like it, share it and subscribe it, Nursing in Handy channel. Thank you for watching.